The NIHR Mental Health Research Initiative aims to address the gap between regional mental health needs and research activity. The MHRI has targeted areas with particularly high burdens of mental health problems by boosting locally relevant mental health research and supporting researchers in the community.
I think we really need to start building the research so that it's happening in the areas where the mental health need is and where we can actually get the people who need it the most involved in it from the very beginning.
It's extremely important to make sure that all communities are being involved, not just in certain geographical areas, but also the underserved populations and regions.
Through targeted calls and new collaborations, the MHRI has increased the geographical spread of mental health research across coastal communities, underserved communities, and the north of England.
The Mental Health in Northern England call recognised that there are far fewer high-quality mental health NIHR studies taking place around the north of England than there are compared to other parts of the UK. We also know that there's a higher incidence of mental health difficulties in the north, and so there's a greater need but less research and activity happening to try and address those needs.
We've got one of the highest mental health prevalences in the country. We're funded to work both into Greater Manchester but also North West Coast, so that includes a number of areas that are particularly deprived, but also particularly diverse in terms of ethnic minority groups. So that's really, really important.
The reason why we need to ensure we are involving and including and engaging people from different communities is to ensure that whatever we produce and at the end of the research is fit for purpose. And it's something that accounts for some of those cultural, religious, ethnicity-related nuances.
So how can we support mental health research that is relevant and inclusive of people in underserved regions?
There might be particular differences and particular challenges across the country that might need different approaches. They might need creative approaches.
What works in one setting may not work in another. Listening very carefully to all the stakeholders within that locality. I think particularly going into the clinical teams and understanding what the drivers and the challenges are, thinking about the leadership, and then I guess also looking across the areas that it serves and getting a good picture.
The MHRI's Flagship Mental Health Research Group programme seeks to address regional inequalities in mental health research and access to care by specifically funding organisations in underserved regions to address local mental health research needs. Take a look at our funding opportunities to find out more.